Cardiac murmur, presented by anesthesia with babar. In this presentation I will explain. First, what is cardiac murmur, second, how to auscultate, third one causes, fourth is types of valvular diseases, fifth one is classification. Introduction. Cardiac murmur is the abnormal or unusual heart sound. It is also called abnormal heart sound or cardiac bruit. Cardiac murmur is heard by stethoscope, along with normal heart sounds. Cardiac murmur is heard by placing chest piece of stethoscope over the auscultatory areas. Murmur due to disease of a particular valve is heard well over the auscultatory area of that valve. Sometimes, the murmur is felt by palpation as thrills. In some patients, murmur is heard without any aid, even at a distance of few feet away from the patient. Causes of murmur. Cardiac murmur is produced because of change in the pattern of blood flow. Normally, blood flows in streamline through the heart and blood vessels. However, during abnormal conditions like valvular diseases, the blood flow becomes turbulent. It produces the cardiac murmur. Murmur is produced because of valvular diseases, septal defects, and vascular defects. Types of valvular diseases. Valvular diseases are of two types, 1 stenosis, 2 incompetence. Classification of valvular diseases. Cardiac murmur is classified into 3 types, A. Systolic murmur, B. Diastolic murmur, C. Continuous murmur. Thanks for watching. Please subscribe, like and comment.